Very good. Well, good afternoon, Robert.
Good afternoon.
Good to see you.
You too, Doc.
Got to use our indoor voices
Yes.
here. I understand you brought your 3 babies in here
Yes.
for their wellness exams, get them up to date on their immunizations and so forth.
Yes.
I want to explain we're going to be doing something different this time as part of our cat-friendly approach to examining felines.
Okay.
And we understand that that they have different needs than dogs. So thinking from the cat's perspective, what will be the least stressful event for them? We're going to be doing something different, which is we're going to be keeping our voices down. We're going to examine them in the place that they want to be, in the manner that they want to be examined, and so forth.
Okay.
So it's going to be different than probably any other wellness exam they've ever had.
Okay.
We're going to do one at a time. And if you're comfortable, you can just have a seat, and I'm going to ask you a few questions.
Okay.
I think the first one we're going to look at is Guinness, who's the nervous guy in the cage. So let's go ahead and open the cage, and he is welcome to come out and explore the room while we're talking.
All right. I think he might like that.
He might like that.
Yeah, such a vicious animal. I had that locked up.
Okay, big guy, you want to stay up there, or you want to come down? Okay, you just stay right where you are. Okay, that's fine. Have a seat, Robert.
Okay.
Got a few questions for you.
All right.
Okay, so when was the last time he had a seizure?
Last year when I took him to the
Was last year. Okay, on the way in or on the way back?
Actually on the way home.
Okay.
Because I didn't put him in a cage. I just let him run around the car.
Okay, fine. How is his appetite doing?
Appetite's fine.
Appetite's
Yeah.
doing good?
They get wet food?
Are they on any medications?
None.
Okay. Heartworm prevention?
They do take the Revolution.
The Revolution?
Once a month, yes.
Great, that's excellent. Okay, I'm going to cover you up there, big guy. Cats like to feel like they're in control of their environment. And by having him in this, he's not seeing what's going on. He's pretending he's in his little hole. And they usually, we don't need to scruff. We try not to scruff or restrain or manhandle any of our cats.
Okay.
So hopefully this will be a good demonstration about how well things can go. Now, if you're at all uncomfortable, you're being present for this, you're welcome to excuse yourself. But one thing we don't like to do with cats is take them out of the room, to the back, to the lab. This is where he'd rather be. It's kind of the Burger King philosophy. Have it your way, you know. We know cats, and we know what motivates them to be fearful. They don't like to have to go to different rooms and be exposed to other noises and odors and so forth, and he's being perfect.
How much blood do you take?
I usually take about 2.5 cc's, which is a half a teaspoon.
That's not much.
No, it's not much. And he could be my blood donor. He's wonderful. Okay. Look at that.
Wow.
Okay. Good boy. And would you have ever thought that he could have been so quiet and good for that? Okay, big guy. You are done. He said, yippee skippy. Thank you, Dr. Kate. Or maybe not, thank you. Bone towel is helpful because it's got all of the scents from home and from the kids.
Right.
So that can be comforting for them. Okay.
Yeah, she's not as bad. She's okay in your lap. She likes to get people to pet her and all too. She doesn't like to be held, and she'll start to growl
Right.
and get out. But
Mm-hmm.
then you can put her down, she won't run away. Pet her all you want, so
Right.
she shouldn't be too bad.
Okay. Any concerns that you're having about Kahlua?
Her teeth.
Her
That's
teeth.
the only one.
Okay.
Yeah, because I have been aware of that, and I check them.
Okay.
And hers is, you know, and I think just because, you know, they say things that I've learned from talking to you and other people here about different cats have different teeth problems. Some
Yeah.
have more than others, and you know, so.
Okay.
And that's just been a concern with her.
Okay, baby girl.
But she eats just fine.
That's good.
So.
Ears look perfect.
She had a bad mite issue at one time.
Did she?
Oh, real
Okay.
bad, yeah.
You got such beautiful blue-green turquoise retinas. Okay, sweetheart. She does have a lot of tartar, but not as much periodontal disease. I might suggest that we do the periodontal screen on her too, and then maybe we prioritize in which order we need to be doing the two dentistries then. Okay. Okay. Here we go, babes. Try not to get blood on this side because you're bleeding over here, babes. Is that a good kitty cat? Let's not get these confused. Got a little blood on that edge, so read that in anytime after 10 seconds. Okay, babes. There you go. Lymph nodes?
It's more like 1 or 2, I guess.
Yeah. So I think we know who our priority is.
Yes.
Do you get? She's the one that gets clipped down, right?
Yes.
Yeah.
The lion cut.
The lion cut. Kidneys feel good. Everything in the abdomen's feeling good. Your bladder feels good. I'm not going to give that a squeeze in the direction you're pointing. Feels good. Oh, you're doing great. Any limping or anything?
No.
Okay, good. Good. Let me come, please. Pretty cat.
Yeah.
She says, I'm loving this. Oop, there's your tartar. Let me get that out. Boy, I just was in the right place in the right time with Guinness with that one flea. It probably just hopped on him. I'm not finding any evidence in any of the other kids as well. Let's see how much you weigh. Just barely in double digits. She's 10 pounds, 1 ounce. Oh. You look quite content up there, sister. .184 is her heart rate. Has anybody ever mentioned to you before that she has a heart murmur? It's not a very loud one. Yeah. Grade 2 mitral murmur. And that just means that she has a heart valve that when it closes is not closing off all the way, and some of the blood is squirting through it and making a boosh, boosh, boosh noise as opposed to a love dub. Some of the things that can be causing heart murmurs in cats can be a heart muscle disease called cardiomyopathy, which causes a thickening of the heart muscle. Cats can get valve diseases just like dogs and people can, mitral valve diseases and so forth. I would say the majority of my heart murmurs in cats are not associated with heart failure or significant heart disease, but there's no way in telling by listening whether it's a significant heart problem like cardiomyopathy or just a minor problem like some damage to the mitral valve. What I can tell you, she's not in heart failure.
Right.
She has heart valve disease, perhaps. She might have heart disease, but her heart appears to be working okay. If you wanted to have more answers and so that you had peace of mind, chest x-rays could be done under light sedation. Or light sedation is just because she wouldn't appreciate being upside down, stretched out on the table. That would be fearful for her, and I don't want anything that would create fear for her.
Right.
That's something that could be done at your convenience in the next few months or so. Okay, could I have the ear thermometer, please? She loves her chin being massaged. Yes, she does. She says, I'm going to come over here closer to Dr. Kate. Yep, 1021. Okay, can I have their immunizations, please? Okay, these on all 3 of the kids, the rabies was given in the right hind leg, as low on the leg as I can get.
Okay.
And the reason we do that is twofold. One, if there are any injection lumps, we know by the location what's caused them. Was it a rabies immunization? Was it the leukemia virus immunization? If it's in any other part of her body, we know that the immunization had nothing to do with a lump. The second thing is we don't like giving injections in cats all in one spot. When I got in veterinary school, we were pretty much taught to give all the vaccines up in the neck area. And because all the vaccines were being put in one location, there you go. Oh, she said, okay, I'm sorry. Can you forgive Dr. Pate? Can you forgive me? Okay, sweetheart. But anyway, we had problems with tumors that can form where vaccines or any kind of chronic trauma is done. So every little thing in one spot over and over again, it's kind of like getting chronic sunburn and then being exposed to skin cancer. So we spread everything out so we can monitor them. And it also lets me know as a medical director whether there's a vaccine brand that I have to be careful of. And we've had a really good track record of not having vaccine-induced cancers and so forth. So you let me know if there's any lumps or bumps.
Okay.
Sweetheart, everything went great.